Today we've got Dr. Sheni Moodley who's joining us. She is a gynecologist and obstetrician, and Dr. Barnard, who's a pediatrician. Thank you so much for joining us. I know both of you are not just doctors, but you're moms at the same time. So I think a lot of the stuff that we're talking about is relevant in more ways than one. Dr. Barnard, I know you have 3-month-old twins. So I think a lot of the questions around what moms are feeling at the moment, you echo them.
Yeah, I think I can relate quite easily with the moms at the moment.
Okay, great. So I think first question, Dr. Moodley is directed at you. What are a lot of the moms you're seeing feeling at the moment?
A lot of moms are very, very scared. They're scared about what happens when they deliver now. They're scared about when the coronavirus outbreak is going to peak and if that's going to be around their deliveries. They are scared about not having their support structures able to come and help them or to be able to travel to the places where their support structures, their families are as well. And they are worried about how their babies will be affected and how to keep themselves safe during this crisis.
And Dr. Barnard, I think similar things must echo with you, what moms are feeling about having a newborn at this stage.
I think moms are very concerned about the virus and also what the implications are for having a baby during this time. But one of the key things that is coming up with a lot of the moms is that feeling that they won't have access to help, not necessarily that they're going to come into contact with the illness itself. But it's a very scary time taking a newborn home and knowing that you're going to be taking a newborn home and literally be isolated from all of your support structures. It's really a concern that's been coming up quite a lot.
And pregnancy and having a newborn are challenging outside of these conditions, just in normal circumstances. So I think our hearts really go out to moms who are going through it at this time, because it's just so much more that they need to deal with. So I think one of the questions that we can jump into, and Dr. Moodley, I think this is directed at you. What happens in terms of who is allowed to go in with a mom? I think there's questions around, can the dad go in? Can a midwife be there? What support can the moms actually have with them, either in terms of being in natural labor or having a C-section?
So the regulations differ in different hospitals. So in state hospitals at the moment, the dads are not allowed to go in. So there is no support person who is allowed in. In most private hospitals, the dad is allowed to go in if the dad has been tested. If the dad and the mom have come in an emergency and are not tested, then they are admitted to a different part of the hospital and a different ward, and they are treated as positive until such time that their tests come back. The turnaround time in private hospitals for tests at the moment is 24 hours. So it's not too long that they're treated separately, but they're treated as positive so that the wards are not contaminated when we don't know what their status is. If the dad leaves the hospital after the birth, he's not allowed to come back in until such time that he's picking mom up, for the simple reason that if he goes to a supermarket or anywhere else and he may become exposed, it exposes the hospital, and we have to worry about the ventilation and duct systems and spread to other patients as well as healthcare workers.
Okay, so you're saying dad can be there, but then once he leaves, he's not really allowed in those visitation hours until he comes to take mom home.
So visitation hours, as far as obs and gynae is concerned, pretty much no longer hold. The rules of the hospital basically allow visitation for a critical patient limited to one visitor only, depending on what that is. Otherwise, literally, the dad has got to come in with mum, stay with the mum for the duration of her stay, or if he leaves, so if he's got kids at home to look after, he then is not allowed back in, and he basically meets mum at pickup from the hospital when she's discharged.
Okay, and has the time in hospital changed at all for natural and cesarean?
We are trying to reduce stays by 1 day as far as is possible. So with our cesarean mums, normally it would have been 4 days in hospital. That's the day of birth and 3 days after. And with natural mums, it would have been the day plus 2 days after. We're trying to reduce each of those by a day, so that they are not exposed in any way, just to reduce exposure as far as is possible. If it's a first-time mum or mum who really feels she needs to stay the additional day, we do allow that because they have been tested, and every single mum has to be tested. So much so that Deliveries, according to the Royal College of Obstetricians and Gynaecologists, have to pretty much be planned now. So the Royal College is suggesting that even for patients who want natural deliveries, that we actually plan an induction at 38 weeks so that the parents can be tested appropriately and so that we don't have unplanned emergency deliveries where we are not catering for testing.
And I'm sure all of that weighs on moms. I mean, especially if you had it in mind and you had a birth plan, which we know often doesn't go according to plan, but you still say, you know, you would like to have a natural birth or you would like to do this. This is like an additional thing now that moms kind of need to adapt to. And I'm sure that must be weighing on them as well.
So it's pretty massive. For example, different scenarios. I have a patient who would like her delivery as close to her due date as possible, even though she is a planned cesarean section. And because of the risk and the testing and the fact that she would have to be treated as positive if she comes in as an emergency, she cannot have that, which means the delivery is timed for 38 weeks, whereas normally we would go to 39 plus weeks. So that's changed. Then I've had another mum who's come in with preterm labor 5 weeks prior to the delivery of her child. Mum and her partner had to be tested. It was a problem because we didn't know if we could arrest the labor and whether the partner would be allowed to stay or would have to leave because the partner is not given a bed until post-delivery normally. So that was a huge problem, and that was at the time where the shops were not even open for the sale of baby clothes. With the first-time baby coming 5 weeks early, the parents had pretty much nothing except the hospital bag that they were given when they came in. So there are huge stress levels around that.
And Dr. Barnard, I mean, I'm sure then you are having similar questions. So what happens if my baby needs to go to the NICU? What does that mean in terms of mom's availability to go into the NICU, and I'm assuming visiting hours similarly will no longer exist for other family members?
So yeah, I think just taking it a step back as well from a delivery perspective, just because Sheni was mentioning it, it's also been quite a challenge for the pediatricians in terms of, we quite involved in the Caesar in terms of being a presence for the parents, taking the photos, giving baby over to dad, letting him having his first cuddle, mom. If the situation arises where we're having to treat parents as, potential positive patients, it means a whole lot of extensive gear on us, faces covered, dad, mom, everyone, that sort of thing. So already the stress level is quite high, and it's not as as warm as we as peds would like it to be for the birth of your baby, which obviously then sets that up. And then being separated from your baby is already quite a stressful thing if your baby has to go to the NICU. Now, you've already had this divide with all of this personal protective equipment on, and then taking your baby away to the NICU. The NICU at the moment, we have there's enough space between every bed, so we don't necessarily need to isolate, but we do have isolation cubicles for those parents that we're treating as potentially positive. So there's a whole little algorithm, and I'm sure we'll get into that a little bit later when we're discussing. But for now, we used to have that grandparents could come in at certain times and visit. And on the first day, we generally would allow family members to come in just to see the baby for the first time and then stick strictly to the visiting hours. But for now, the NICU has unfortunately only allowing dad in to come and visit, and obviously mom, and they're very strict visiting times. Obviously for the mom it's slightly different because she'll be involved with the feeding, but grandparents are now no longer allowed in. And there are actually some NICUs in Johannesburg, peds ICUs as well, that are actually not even letting parents come in when babies are being admitted. So it depends on the situation. So like Sheni was saying, different centers have different rules. So you'll find that in some centers, doctors, nurses are making use a lot of WhatsApp, taking lots of photos, video calling, parents are video calling with grandparents, to try and share the experience, but as best they can, being so cut off.
Most definitely. And what happens in an instance where baby goes to NICU, mom now needs to leave the hospital? I mean, I can only speak from experience. When my little one was in NICU, I was fortunate enough to be able to lodge at the hospital and stay for a few days while he was there, which meant I could be there for breastfeeding and a whole bunch of those timings. But I'm assuming that's also changed. So what happens now if mom goes home and then wants to come back to the hospital?
So from our side, we can't allow lodging anymore because we have joined our maternity and our labor wards in our hospital. As I said, different centers will be different. So we can't have lodging anymore because we have divided our hospital into COVID and non-COVID areas. And for that reason, our maternity and labor ward are together. So we're generally quite full. So we don't have that lodging option. So that's a little bit of a problem. And then little things like Kim just mentioned in the last question, we can't do skin on skin easily at a delivery for a mum because it's a problem if it's a potential COVID positive patient or if you have a false negative. So we've stepped away from that and having additional members present in the birth like doulas and midwives from that perspective, just to build on the previous answer. And then Kim, from your side?
So from our side, there's also not really a lodging facility available anymore. Even in our pediatric ward, we used to let parents potentially lodge in the peds ward or in the day ward as well. Unfortunately, that's fallen away. And we've also become stricter with only one parent, let's say, staying in pediatric ward and not even allowing any visitors, even if it's dad downstairs for peds. So unfortunately, that has impacted a little bit, and particularly, as you'll know, when you're a mom and your baby's in ICU, it's every 3 hours trying to express milk and trying to get that milk to us. So they're trying to offer the moms as much support as they can and streamline that so you're only coming in a few times during the day with your milk supply and potentially staying a little bit longer during your visiting time. But it's definitely not as easy anymore to just stay as close as you want to your baby.
Yeah, it makes it
But
a lot
again,
harder.
the centers, have different facilities.
Most definitely. And speaking about the virus, what happens in a situation where, and I think we'll first go to Dr. Moodley, if a mom does have the virus, what does that mean in terms of implications, her health and baby's health?
Okay, so most mums generally have very mild disease. The virus does cross the placenta. It does affect babies. So we have had, not at our center, but of the 2 mums with the virus in South Africa, one in Johannesburg and one in KZN, both mum and baby were infected. However, they both had no comorbidities at all. It was mild disease. So mum and baby self-isolated at home. So where it is mild disease, they can be self-isolated. Where it is severe disease, yes, mum may have to be separated from baby because it becomes a multidisciplinary team that needs to look after mum depending on how severe the disease is and whether intensive care is needed. So then our pulmonologists, etc., get involved. So far, even internationally, there have been very few cases in pregnant women of severe disease. Yes, pregnant women are affected by the virus. So yes, they do have to be cautious. They do have to be kept safe. However, their morbidity is not higher than that of the general population, even though there is a lower immunity in pregnancy. We are promoting the flu vaccine in all pregnant women. No, the flu vaccine does not prevent COVID. However, there is some cross cover against strep pneumoniae, which is in the flu vaccine, and coverage for this virus as well. So we do promote both mum and the family members who are involved with mum to have the flu vaccine as well.
Okay, great. And Dr. Barnard, I think similarly, what happens if after birth, family goes home and mom contracts the virus or baby contracts the virus? What does that mean? Because there's a whole lot of implications around, can I still breastfeed? What does it mean? Do I need to be separate from my baby? Could you maybe talk us through some of those scenarios?
So, I mean, what we know from the literature and just, generally what's been happening is that everyone is as susceptible to picking up the virus as the next person, and children are just as easily susceptible to picking it up. But they actually tend to be asymptomatic or have milder disease than adults. And we're not quite sure yet what the physiology is behind that, and studies are still ongoing. So, children tend to be asymptomatic carriers or mild disease. So the general sort of consensus is if mom is infected and well, she can continue to breastfeed. We do promote sort of universal precautions. So obviously hand washing. We do advocate, or the CDC advocates wearing a mask while breastfeeding as well at that time, because it's droplet spread. So that's how you would pass it on to your little one. If you can, in the beginning of the illness, express and bottle feed, that's obviously ideal, and getting someone else to do that for you. But again, as most moms will know, in the beginning, trying to express milk, when you're tired and stressed, and then now having to attach yourself to a pump, it adds to all of it. So, we're sort of taking the view of if you're feeling well and you can do the universal precautions, then continue to breastfeed. If you're unwell though, and that, spiking temperatures or very, having a lot of respiratory disease, then it's advocated that you actually don't breastfeed during that time until your symptoms subside a little. So you can express your breast milk, have dad or whoever else is isolating in your house, giving the breast milk, or you can opt to formula feed as well during that time. But yeah, it's not a no, you can't breastfeed at all if you get infected.
Yeah, and I think there's so many knock-on effects. I mean, just the stress of the situation. It's not that normal situation of, okay, I can just quickly pop to the shops and get a tin of formula or get whatever I need, because a lot of the shops are restricted, and so moms must be feeling, and again, the knock-on effects that this may be drying up breast milk or leading to other issues.
Yeah, talking about going to the shops, I think it's very important that if a mom or a baby or a family member in that household are affected, that is self-isolation. They do not go to the shops. So you cannot easily get formula. You would actually have to have it delivered. You would have to wear a mask and wash hands for someone to hand you that delivery packet, because otherwise you're not isolating and you're infecting other people. And so just wearing a mask and going to the shops, if you know that you have been exposed, is a problem. So yes, a mask restricts spread, but if you are self-isolating and if you are in contact with someone who is infected, you actually can't even pop out to the shops. You'd rather then get the online deliveries like Dischem and Clicks and all the rest of them are doing if you need to get formula, because you have the potential of causing more harm.
Yeah. I think that also, besides the formula, having access to lactation consultants or having access to breast pumps as well is quite a thing. You may never anticipate not being able to properly breastfeed, or you may have put off buying the breast pump because it was a little bit on the pricey side, or you always thought that you'd have access to lactation consultants, and now when you don't, even if you're not an infected person, but obviously no one's traveling around, no one has these permits, wasn't considered an essential item, essentially, you really have, or it feels like you have a limited access to avenues to feed your baby, which I think then adds more to that feeling of isolation, and of course adds to stress, which impacts on breast milk production. So, besides now having to order everything online, not everything necessarily is available, which is scary.
Things that can be scripted, you can get delivered. So like Dischem has Pack My Meds. Yes, I agree with Kim, not everything is easily available. But for example, a breast pump, we actually are allowed to script with an ICD-10 code. So it can be packed from suppliers such as Dischem. Problems are like you can't get things like nipple shields as easily, but even something like a nipple cream we can actually script. There are breastfeeding consultants who are trying to do Skype consults. It's not easy because it's very hard to describe latch on a Skype consult. So those things really not as easily accessible. But where parents are struggling, they need to actually pop us an email and ask for some sort of support, and where we can give them avenues that they have available that they may not know they have available, we can actually point them in the right direction.
So yeah, I mean, the lactation consultants, besides Skype or Zoom, they are WhatsApping, they are using videos to show you how to latch. They are, I mean, just from my own experience, and I use the lactation consultants as well. I mean, she would WhatsApp me all the time to find out how everything was going, check on, the supply, check how I was doing. Was I eating enough? Was I drinking enough fluids? So there is that support that they are providing, and it does definitely help. And, like Sheni said, it's not that easy to describe a latch, but a video of a latch does sort of help, and talking through with a doll and a model, and videoing, yourself trying to latch, that all does help. And it really does, lend to the whole village coming together to provide a service.
Yeah, that village is so important. And not having it, it's not that it is gone. We have to find new ways and speak about new ways that village does still exist. We just have to access it differently, and allow moms access to that information of how to access those other people.
So talking about that, some of the other questions that patients have had concerns about is what happens now with antenatal classes, what happens with 4D scans. So 4D scans are run out, they have been cancelled. However, on Skype and on Zoom, the actual antenatal classes can still be done. So that is possible, and patients should not be stranded. So if they contact their gynecologist should be able to put them in touch with someone who can actually still do the antenatal classes and antenatal videos with them.
And what happens with vaccinations? So after the baby's born, there's a ton of vax, and you, in a, I dare say, normal situation, but out of COVID situation, you would be popping to the clinic to get your baby weighed, to have the vaccinations. Are moms feeling a bit more hesitant about that? But it's obviously something that they still need to keep up with.
So, I mean, from our side, I mean, you spend the 3-4 days seeing the baby in the hospital every day. We do weighing every day. We're checking for jaundice. We're checking for general signs of well-being. And then our sort of first port of call will be to tell the mom, in a week, we need to see a weight. So you need to come back. Most practices have a nursing practitioner that will weigh. So we'll say, come back in a week. We'll do a weight check. If you have any questions, you can speak to the nurse. If there's any questions she can't answer, you have access to us. Now you basically telling someone, you need to bring your child to a doctor's office for a weight check, which does bring about fear symptoms, because you're thinking like, what if there's a COVID patient or someone who's sick in the waiting room? Vaccines are extremely important, and worldwide, the World Health Organization is advocating to continue with the vaccines, because coronavirus is not the only disease going around. And I mean, right now we're in RSV season, which is a difficult respiratory virus, can cause, very severe disease in a newborn. We don't want to fall behind on our pneumococcal vaccinations, as Sheni said, because, it's a very big cause of pneumonia in small children. So vaccines are so important for our parents to continue getting them. So, I mean, our pediatric practice, just as an example, and I know all pediatric practices have started doing this, but they have sort of divided up the practice into those patients that have answered certain questions, like, does your child have a fever? So you're really sort of putting them through one entrance into one waiting room. And our vaccine clinic is a completely separate access, where you're not, coming into contact with potentially sick patients. Appointments are being staggered, so there's space between the appointments so that you're not sitting in the waiting room with whoever else, and being worried about that. So they're really trying to make it as stress-free as possible for you to still come and do those vaccinations and do those weight checks. So, just to emphasize that it is really still important to do that. And you can phone your pediatric practice and you can ask them what the drill is. How will my baby be coming into the practice? A lot of our parents will opt to stay in their vehicle, and then our secretaries or the nurse will phone them and say, okay, the room's been cleared and it's been cleaned. You're welcome to come in now. So, we're trying to alleviate that stress so that we're still getting those vaccines and those weight checks on board. Because, weight check in the first week is also extremely important. It tells us a lot. Is the baby well? Is the feeding going well? Is it actually a feeding issue? Is it a supply issue? Is there something else more sinister going on? So it's not just that we want to make sure that your baby is, plumping up. It actually does serve quite a vital role. So again, it gives the parents that little boost as well when your baby's picked up, have a little bit of weight. It makes
100%.
you feel like a hero. So, it's so important.
100%. That for a mom, and again, I can only speak for myself, but there's no worse news when you hear that your baby isn't thriving and isn't putting it on. But then the advice that comes of what you can do differently is so needed. And then on the flip side, when the doctor says and the nurse says your baby's put on weight, and you just feel like, yes, I am. He is or she is feeding enough. My breast milk must be enough, because you're not able to measure it and you don't know. So just for mom's mental health, at the same time, just having those visits, and also a lot of the time that's contact. If you have been staying home with a newborn, sometimes just seeing someone else and talking to them is also just so important, because the nurse for the first time really asks, how are you doing, which are questions you don't really get anymore.
Yeah.
So important. Another thing that I wanted to touch on was not just in terms of C-sections, but what's happening with moms who might miscarry, or moms who a termination is needed. I think there's a lot of concern around them saying what elective surgeries are and what surgeries are and aren't allowed, and what happens for moms in those situations right now.
So basically, if a surgery can be avoided, it needs to be avoided, purely because we've got to worry about negative pressure ventilation systems and the risk of spread of the virus, etc. So if we can handle those medically without needing theatre, we try to handle them medically. It's not always successful, but a pregnancy less than 9 weeks, or pregnancy that has failed from 20 weeks and above, can actually be complete without needing theatre. We do need to give them their time, and I've already had 2 such patients in this time that we've had to handle medically, and so far they have been fine, and we have managed to avoid theatre. Between 9 and 20 weeks, these mums generally will need theatre, because there's a membrane that is extremely adherent that does need to come out, and that is cleaned in the theatre process, because that can cause sepsis long term, and it can also prevent proper implantation for a future pregnancy, as well as cause immune reactivity. So those patients, unfortunately, will need theatre. That is regarded as emergency. That is not regarded as elective surgery. So although elective is a term that's thrown about, elective is, in this scenario, in the COVID scenario, refers to a surgery that can be avoided. Surgeries that cannot be avoided, that would be detrimental to mum's health, should they be avoided, actually do need to be done.
Okay, understandably. And as much as Dr. Barnard was speaking about how important that follow-up is the 6-week checkup with your gynae still happening as well?
Absolutely needs to happen. It is absolutely vital for a number of reasons. One of the reasons being that a patient can have postpartum sepsis, and if that is left for too long, so it's not just the 6-week checkup, there's a checkup somewhere around 10 days, so 1 to 2 weeks post-delivery, and a checkup at 6 weeks, because postnatal sepsis can be really severe. You can still get postnatal hypertension. You can get emboli or pulmonary embolus, clots in the legs, clots in the lungs that can happen. And if you've missed this, it becomes detrimental to mum's health overall. So absolutely still important. So if patients are worried about what checkups are essential, they can go into the Royal College of Obs and Gynae, the RCOG website, and that shows you that, okay, maybe your 16-week visit, if you really do miss or are in telephonic contact with your doctor, not as essential, but your 12-week, your 20-week, your 28-week visits, your 36 weeks visits, absolutely essential. If you have 5 or less antenatal visits, you are more prone to complications, but we should try and reduce the number of visits that a patient has in pregnancy to 8 visits in the pregnancy as far as is possible. So we are reducing visits, but remember, pregnancy is a high-risk condition. And if vital areas are missed in your visits, because you cannot do urine checks at home, for example, to check if there's protein in the urine. You cannot check whether this baby is growing at home, whether the placenta is failing, etc. So there are visits that are absolutely vital that cannot be avoided.
No, it makes complete sense.
Can I ask, is that the same for a singleton versus a multiple pregnancy, the number of visits?
No, multiple pregnancy is generally more, because multiple pregnancy has a greater risk of everything, actually. Preterm labor, preeclampsia, risk of gestational diabetes is higher. Generally, term for multiple pregnancies, as you know, is moved forward. Patients in the third trimester of multiple pregnancy is exceptionally tricky. So there is no way that we can actually reduce number of visits from that perspective. And the reality is, if a patient misses a visit because we've said they need to miss a visit, we become medico-legally liable for anything that happens. So we cannot actually say miss a visit. If a patient misses the visit by their own choice, they are taking that risk.
I mean, I'm just thinking, in the space of a week with me, something changed. So if I had missed the visit, it would have had a very big impact.
Absolutely. We've had patients where we've had to say, listen, we need to see you in a week's time, but we've tried to, for example, stretch it to 10 days instead of a week, so that in a 3-week period they would have 2 visits instead of 3 visits. So we've tried to reduce it that way. But when we have a baby who is just not growing, a severely high risk patient who's lost prior pregnancies, we can't take those risks.
Yeah.
I think it's quite important what's being highlighted here, in that everyone's so focused on the virus that you tend to put everything else aside, that there's actually other things that can do me harm if I don't sort of attend to myself or my child.
That's exactly it. That's exactly it. We're finding patients sending us emails for things that need visits, which is a problem, because you cannot diagnose those things on emails, and all the complications that could have happened anyway can still happen. They're not going to suddenly not happen because there's this virus around. And the reality, if you look at the percentage deaths worldwide, yes, there are a lot of deaths from the virus, but the deaths in the population are basically less than 1% of each of the country's population, if you look at the population density. So people know there's this virus that kills. And yes, we have to take it severely. And the most important thing that people can do is actually wear a mask, because the mask does not prevent you getting the virus, but it prevents you spreading the virus should you have had a false negative or be one of the asymptomatic carriers. So the more people who wear masks, the more we are all protected, and we're protecting each other. And then, as you mentioned earlier, Kim, the usual things that we've been speaking about, hand washing. Even if you go to a grocery store, having a change of clothes when you come home, and changing in the garage. If you hang those clothes out for 3 days, those are fine if you've just worn them for a short amount of time, so that when you go into the house, you're not wearing contaminated clothing, especially if you've got a newborn baby at home. Those sort of factors are little things that you can actually do, and don't go out if it's not necessary, even if lockdown phases down to level 4 or level 3. If you've got a new baby and if you're at home, do not go out if it is not necessary.
I think that's great advice to give.
I was also just thinking from our side, one of the things that pediatricians are really quite worried about at this point is, parents putting off coming in. Oh, I'll just wait until the fever comes down. And the kids that are coming in quite sick, and then that's posing a separate set of complications, because now you're having to admit, or potentially, which you don't want to do because you don't want to be putting people in hospital, or potentially treating quite a sick patient as an outpatient, which may necessitate a lot more, coming back and forward to the office. So that's also just something to keep in mind. And when you're thinking to yourself, should I see my pediatrician, maybe, or my obstetrician, maybe that's the time you should be at least touching base with the offices and finding out. And your pediatrician or your obstetrician will be the first to tell you. You don't just do it willy-nilly. They'll say, please come in because we're worried.
And the other thing is, our patients are actually at a greater risk going to the grocery store, because we are being so careful, because we are so wary of risks. So we're being so careful to wash our hands, put on alcohol, swap things down, clean things down, social distancing, all of that we're actually really, really being careful in the hospitals, in the rooms, as far as we can be. We're also screening with our emails that we send out to ask, do you have a cough? Do you have a fever, etc.? None of that screening is being done going to a grocery store. So I think the vital point is not to miss your visits. And then one of the things we worry about is mums being affected by the isolation. And actually your visit to your caregiver, because you've got this bond with your caregiver as well, reduces that isolation, because it's a lot of advice that you get at that visit. In my culture, we're not allowed to go out for 6 weeks after having a baby. And I used to look forward to my nursing sister visit to go and have that weigh in and that checkup, because it was my little bit of time out of the house, because it drives you crazy being stuck in the house nonstop. Yeah.
Oh, yes.
I think we can all agree with that. I think one thing, and I think that leads us to, is mental health. We can talk a lot about medically, but at the same time, all of these issues are most certainly weighing on moms, and I'm sure it must be increasingly hard in a lockdown situation where at the moment you can't necessarily go for a walk. You can't go to a gym if you were going to a gym, or having a swim. And so maybe the exercise that you were doing that was helping you, or just going to a shopping center to walk around, you can't do those things anymore. And it's also, I'm sure that must be affecting moms in a big way.
So that's huge. I've already had letters requesting, I've had requests for letters to allow moms to exercise, which I can't actually legally do, especially at level 5 of lockdown. But at level 4, they should be able to go for a stroll outside. So let's hope that happens. However, there's a few things with that. Number one is that when you're at a gym, let's face it, walking on the treadmill is not the most interesting thing. You're sitting in one spot and you're walking on that treadmill nonstop. So there's no excuse, no matter how limited your restrictions are, from walking up and down your passage or round and round your kitchen table at home and getting those steps in. In fact, if you have a step, you just need 1 or 2 steps, and you can just do steps up and, or you can do yoga. There's yoga for pregnant women. There's yoga for postpartum. There are exercises for diastasis of the tummy, where the abdomen spreads apart, and you can find those very easily on YouTube. So exercise should definitely still carry on, because that reduces your postpartum depression, or it helps you to get through the postpartum blues. Number 2, have a goal. If you have a goal and you follow a goal and you are set on achieving that goal, you have less of a chance of having postnatal depression. So that goal may be something as simple as getting into a routine or surviving these 6 weeks with your baby or longer, in terms of being at home and getting through each day as effortlessly as possible. It's not possible always to be effortless, but actually to give yourself a pat on the back. Hang on, I actually handled that really well, and I managed to get in 10 minutes of exercise. Yes, it's only 10 minutes, but it was something. And I've eaten healthily for today, so I'm feeling really good, because now my tummy is going to go down. Something as simple as that, that just having a goal helps. And number 3, make social contact. So no, you can't go and give your loved ones a hug, and you can't visit them, but little video calls, etc., do make a little bit of a difference. Sending out pictures of your baby to your family members who are interested, and the little videos do make a difference. My cousin, who's in KZN, had a baby in Jan, and she shares those little videos with us, and we're always messaging her about how these videos are going. And recently she's decided to take the plunge and start him on a little bit of butternut, and shows us the little videos, and it keeps her going, because we're in contact all the time, and we're encouraging her, and we're speaking about what we're seeing. So you don't have to socially isolate. Yes, we are distancing, but you don't have to socially isolate. You can make contact. And then the psychiatrists and the psychologists are doing Skype consults as well. So if it comes to that point where you are not coping, there are Skype consults that are being done by both psychologists and psychiatrists as well.
And not to be afraid to reach out. And I recently had a conversation with a perinatal social worker, and she was saying, if you broke your wrist, you would go to the hospital and you'd have an x-ray and you'd have the cast put on it, and no one would question anything about it. But yet mental health isn't always seen as the same, and it's so important to reach out and to say, I'm really not feeling myself, or I'm battling today, and that's okay, and that's normal, and we should be supporting each other to reach out, because there is help available.
And the other problem is moms tend to take everything onto their own plate. There is the dad too. And that needs to be recognized, because when moms get frustrated, they feel, well, I'll just do it and I'll do everything. But that's not exactly great for their mental health, and it's nor is it great for the relationship, because especially if you're in lockdown and stuck with your partner nonstop and this new baby who just will not stop crying, it's really hard, because you can lash out at each other and it can be detrimental to your marriage as well. So sometimes it's important to learn where to actually just step back and let go and say, right, you're handling baby for these hours, please, because I need to just step away. No, you can't step away from your baby's cries, especially if you're at home, because you're not actually going anywhere. But you need to have that time where you actually just step away for a little bit. As long as your baby is in a safe place, you know your baby's okay, because there are domestic issues going on. Not every mom is happy. That is a huge strain on a father who has no idea what to do, that causes domestic violence, that causes breakdowns in relationships. So, reality.
Yeah.
I think also just, having gone through this, just, a little bit of a personal sort of experience. I mean, obviously everyone is different, but like Sheni said, have a goal. Like for the first 6 weeks, your goal is pretty much like keep this little human alive, like feed, change, go through those motions, and it's all consuming all the time because it's such a huge responsibility. And I mean, I have an almost 5-year-old as well. And then, you think, okay, I've done this, it'll be okay the second time around. But those first 6 weeks are as explosive the second time around as the first time, because, you're not sleeping. It's a different little human. You've forgotten that, because now your 5-year-old's kind of independent, you're forgetting that this person depends on you so much. So, you tend to get bogged down with all of that. And, we, besides our village in terms of family, we're very fortunate in South Africa that, you can have a nanny who can help you. And that's something that may not be possible now. So, moms are not getting that 5 minutes of time necessarily away. And, in my situation, my husband's still working because, he's in the medical field. So it's not so easy to say, please take both babies,
Yeah.
and when he's coming home, he's social distancing as well, like in the beginning, because we didn't know what was happening at work. And if you're like, let's say if your partner works at a grocery store, they don't know who they're coming in contact with. So there's that, do you want to come near the newborn baby? So that's also something that is impacting on families, is that mom is alone, or mom is with baby. And if there's a partner who's working, that partner may not necessarily want to come so much in contact with their newborn, because they also scared that maybe they're bringing something home. So it's very important, like Sheni said, sometimes to just take a little mini, even if it's just a little mini mental break, where you go out into the garden and you just count to 10, take a deep breath, and you're able to come inside. But it's not always possible. And I think the reality is that we have to realize that our parents are taking an immense amount of strain, and this isn't a normal situation. And I think that's what's got to be emphasized, is that you are trying to parent and you're trying to be the best mom that you can be, which we all try and be, in a very abnormal situation. And it's okay to feel overwhelmed, and it's okay to feel, I don't know how I'm going to do this. And it's okay to feel like, or who can I turn to? But to then know, and I think that that's why this is so important, that you're letting people know that there are ways in which that they can make contact with their pediatrician, make contact with their obstetrician, And what's nice as well that I've been noticing is people are coming up with really unique ways to show affection or give support to moms at home. Buying a little massage voucher, which is supporting someone local in their business for after the lockdown, or having groceries delivered to the house. Sure, you still got to cook them, but at least you didn't have to go and buy them. And in that little grocery packet, having bubble bath and a cream and something like that, or, a little baby grow for the babies, so people are getting really creative, which is really nice, I think. And it does help ease the situation quite a lot.
Thank
And
you.
then when the mom has an older child as well, there's still the homeschooling. The older child still needs attention. You cannot only give the attention to the babies. You have got to give that attention to that older child as well. In fact, probably more importantly so, because the babies are not going to remember anything in the first 5 months, but that older child is going to remember things and need that stimulation. Yeah,
exactly. But it also adds to mom exhaustion because you're going between, whereas let's say your older child would have had a couple of hours at school where, if there was a break with the babies, you could take a break. If you have your older child at home now, it's baby goes to sleep, spend time with older child, doing school, doing Zoom, doing their violin lesson or whatever, so there are, there's not a lot of time for breaks. And, so it's a tough situation. And I don't think there's a perfect answer for everything. I think the answer is you need to make it work within your situation and use the avenues that everyone has provided, baby massage classes online, your pediatrician, your obstetrician, make use of those resources. It doesn't make you a weak person, it makes you human.
And give yourself recognition. Give yourself recognition for what you're doing. People fail to give themselves recognition, and that's so important.
Most definitely. And to be there for each other. I say it so often. I think it's only once you've had a child that you realize how much someone else's support to you at that time meant to you, and that allows you to be there. I'll never forget that friends bringing around a cooked meal the first time we had a baby was something I maybe had never thought of doing, but it was a lifesaver in that moment, because in amongst all the tears and the chaos and not knowing what to do, I didn't have to worry about cooking. And like you say, there are ways that we can still go online, order some food, send it to someone, the smallest gesture, or just checking in, making the effort to send that WhatsApp or the voice note or whatever it is, and just, not be scared to say, how are you really feeling? It's not just about how's the baby and what are they doing, but to just check in on mom as well and support each other.
Yeah.
I
think it's hard for everyone. It's like so many people tell me, oh, you're a pediatrician, this must be so easy. It is hard. It doesn't matter who you are. Everyone needs help.
I really just want to thank both of you so much for your time and for your insights. I'm sure that those watching this are going to find it so valuable, and that we hope, someone watching it who is either pregnant or has just had a new baby just finds the comfort in knowing you're not alone. And on our Facebook page, we'll also put all the links to the different centers that we've spoken about so that you can reach out and you can get the help that you need. So thank you so much for joining us. I hope that you both get some sleep tonight, because we know sleep is also...
I don't have a small baby.
That's okay. That is such a pipe dream at this point. Yes.
But thank you so much for joining us.
Thanks for having us.
Okay, bye.